Governor, does that suggest that you support full parity for mental health coverage? Certainly your senior senator of your state, Pete Domenici, has been very outspoken, has been a national leader on that very subject, but opponents say, look, this is just going to talk about rising costs, that costs would just explode if in fact mental health services were covered the same way as physical health services.
I would include mental health services. Yes, I would. But see, everybody is talking about costs. And what I'm saying is if we manage our healthcare system more efficiently, eliminate a lot of the duplication. Just think 31% of our healthcare costs is bureaucracy and red tape, and it's not direct care. If we find ways to make that more efficient with perhaps electronic records, with, you have 50 states managing 50 Medicaid programs. You've got a Medicare system that has hundreds of healthcare plans administering it. If you're able to find an elimination of that bureaucracy and red tape and make it more efficient, you would have that 31% go more to direct care. So those that say you need to increase the tax, you need to find other sources of revenue, I believe we can do it within the existing system and cover all Americans and control costs and be fair. But one of an essential component of the plan that I've outlined is that we all have to be part of it. Employers, employees, the state, the federal government, a cooperative, collaborative relationship catalyzed by the government, making healthcare universal coverage something that we can do, I believe, as I said, within a year. I believe it's doable.
Well, I think we have time for one more question, and that would be, so you propose basically building on the existing systems that we have and attacking this problem from a number of different directions. Which one do you do first?
Well, you have to do them both at the same time. You have to control costs, and you have to expand healthcare coverage. But I propose, as you said, some new ideas within an existing system. And the new ideas are the trade between Medicare and Medicaid, what the states would do. It has to be an exchange. We have to make sure that the states do spend money on SCHIP, on children, on families. A new initiative would be what this gentleman proposed, and that is let all Americans, businesses, families be part of the federal healthcare system that the Congress enjoys. And with our veterans, I mean, you're talking about a sizable population. Give them access anywhere they want to go. If it's 2 blocks from their home, they have to drive miles and miles. This is all new within an existing system. And then finally, just find ways to ensure that the states and the federal government have a cooperative relationship. I'm a governor. It's very hard for us to get waivers to do some of the experiments that are so important to the SEIU, to the American people. The bureaucracy strangles our system so much that a major component has to be a way to tame the bureaucracy so that it works for people and not against people.
Well, thank you very much, Governor Richardson. Thank you for being here today.
Rick was good.
It's great to see you, too.
Well, I've been it ever since I was a kid at school.